Well, I want to welcome everybody back to our series celebrating giants of physical therapy in Kentucky. I'm excited today for today's episode in that we have the honor of hosting our guest, Dr. Janice Kuperstein, today as our true giant. Her work in advancing our profession has been extensive as she's engaged in many different areas from academia to research, advocacy for our profession, the Kentucky Board, our association, and much more. So we're excited to hear a little bit from her. She's brought mentoring and wisdom to so many of us, including myself. And she happens to be one of my favorite people to listen to, as her articulate expressions and her clarity and delivery is a delight to listen to. So I'm excited to hear our very own Beth Ennis will be engaging her in our upcoming Q&A. But first, we have Ron Mead to welcome back as our membership committee chair, who will be joined with Saji Amrin from the UK DPT program to learn a little bit more about PT Moves Me campaign and what that's all about. So without further ado, I'll toss it over to Ron.
Thank you, Charlie. And I am here with Saji, and you're on your clinical at UK, I understand. Saji is also active in DEI activities within the state association. So you're on that subcommittee. If anyone wants to be a part of that, you just let me know and we will hook you up. But Saji, you are UK's ambassador to the PT Moves Me campaign. So what can you tell us about the PT Moves Me campaign?
Yeah, so the APTA PT Moves Me organization is just an organization that's tailored towards engaging our PT and PTA programs across the country to further the efforts of student recruitment, raising awareness of PT as a career choice. I can talk about it for probably hours, but I'll spare you all. So we're on a mission to do a few things. One, we want to reach our underrepresented minorities, starting even at the primary level, kindergarten through fifth, and then onwards into high school or middle school and high school and college. And really, we just want to empower and uplift our youth and show them the value and the excellence of a career that I believe offers so much. We also want to ensure that admission processes don't hinder, but encourage diverse populations. And three, we want to build a community of PTs and PTAs that are representative of the patient populations we're serving. It's clear now more than ever that perspective really does matter. And this program, hopefully, is an intentional and active measure to move our field into a direction of growth and ultimately better serve our patients.
That's great. And, this is a program that all of the academic institutions in Kentucky can participate in. So hopefully, and maybe some of these colleges can interact and collaborate on some of these opportunities, some of these recruitment opportunities. But you've done a great job, and you do a great job on the DEI subcommittee.
Thank you, Ron.
I appreciate everything that you do for the association. Yeah. So I think what we'll do now, Saji, is we will hand this off to Beth so that we can hear a little bit about what Janice Kuperstein is up to. She's up to a lot. She's a busy lady.
Yes, she really is.
Thank you, Ron. I appreciate it. And I am so excited to be able to be the one interviewing because Dr. Kuperstein has become not only a mentor since I moved to Kentucky 20 years ago, but a good friend. I have been so fortunate to be able to engage with her in so many different arenas, but we're thrilled to have her here today. And I've promised not to go terribly rogue. So I'm going to try and stick with what we had planned. Janice, welcome. And
Thank you.
Could just start with what got you interested in PT? What motivated you to head towards this profession in the first place?
It is such a fabulous thing that Saji was our leadoff today, because I am someone who could have otherwise been missed. So I was in academic programs through elementary and high school where I was headed to be a doctor. And when I was 15, a high school friend, I was a junior in high school, told me about physical therapy. And that was really happenstance, honestly. And I had never been to a physical therapist. I had never met a physical therapist. And I thought, well, that sounds interesting. And so I started volunteering at the Jewish Institute for Geriatric Care, which was walking distance from my house.
Mm-hmm.
And I fell in love with the profession and realized that rather than be the person who just tells you what's wrong with you, I wanted to be the person who was able to work with you to help have a better life and better function. And I would not have known that were it not for that happenstance of a friend. And so what Saji was talking about is so important. If we want to diversify, we need to make sure that people understand what physical therapy is. And the Physical Therapy Moves Me program is just perfect for that. When I talk to students who are from diverse backgrounds, I often hear that it was just happenstance.
Mm-hmm.
So I love that Saji was our kickoff, and I love that program.
Absolutely. So you have been involved with so many different things related to physical therapy, especially in the state of Kentucky, but also nationally. Before I have you touch on some of those things, I want to find out who your guides, who your mentors, who your inspirations have been that we're going to lead into me picking your brain about all the different things you've done.
Okay, so that is tough to answer without saying that. So my underlying belief and culture and what drives me is the commitment to tikkun olam, which is repairing the world. And I have come to believe that to repair the world, we need to do that by repairing health of people and communities and society. So I have had so many people who along the way have helped motivate me to make that happen. And have given me opportunities to practice being who I aspire to be. So naming people is tough.
It's hard. Yeah.
There are so many. I mean, honestly, I would say every single person on this interview helps inspire me and guide me. You do. Charlie does. Ron does. Saji does. Because we're all giving each other opportunities to advance the profession and, more importantly, the world, to repair where it needs to be. So I hope that's not looking like I'm evading the question.
No.
It's honestly everybody with whom I come in contact who does this work, is working together and helping me practice being who I aspire to be.
It's highlighting the connections that we all have, and I think that's so powerful for people. Can you share some of the Janice Kuperstein highlight reel of experiences, of contributions, of events, of moments that have continued to help you move forward and kind of guided your path? Because it's been such a varied path. There have been so many things that you've been involved in, and there's not always a clear connection between A and B in what we do. And so if there are highlights that you can hit for us that were just inspiring to you, that would be wonderful.
Well, I guess I would start with the fact that I started out in pediatrics.
Mm-hmm.
I worked at an amazing facility in upstate New York, where we treated children from 6 weeks old all the way through childhood, and including going into the school systems.
Mm-hmm.
Highlight reels at that point were honestly, well, I'll tell you one that I can never forget. Well, two that I can never forget. When I was leaving there, one of the little girls I had been treating was, as my surprise present, had worked with her mom on taking some steps without her rolling walker. And so she walked over to give me a bye. Oh my gosh.
Yeah.
Another one that was really more how we help children in the world was I was working with a child right before Christmas. And we were in the gym and Santa Claus came in. And this little girl happened to be nonverbal. And so she asked me, "Who's that?" And I said it was Santa. And Santa started signing to her. It was amazing. Tears all over the place because this little girl's world included a Santa who could talk to her. So that was amazing. Then when I moved to Virginia, I left Syracuse, I moved to Virginia, and this is part of the highlight reel. I worked in the school system, and those of you who know me know that a summer off is not consistent with Janice Kuperstein. And so I was asked to sub for somebody in a cancer rehab program where we were treating people from diagnosis through either recovery or through death. And I thought, ooh, pediatrics to that. I thought that would be depressing, quite honestly. But I thought, how depressed could I get in the summer? I'll go swim. I'll be okay. Well, that was a transition that was, what an amazing gift. I found people inviting me on their journey through what other people were afraid to enter. And I could help them have a better quality end of life because of my physical therapy skills. What an amazing gift. And frankly, that summer switched into, I did that while I went to graduate school. And I still do hospice work because many people don't understand that physical therapists and physical therapist assistants can help people live the best end of life possible. So that was another trajectory. Then I moved to Kentucky, and I did stay involved in hospice, as I said. I still do it for my faith community. But I became the director of rehab at an acute care hospital. Shift again. And I had the opportunity to work with, I was new to the area, and there was a Lexington area director of rehab steering committee or whatever group. And there were some heavy hitter old names that will be familiar. Linda Langley in that group, Stuart Lowenthal. And so they involved me in KPTA at the time, KPTA. It was great, but they also involved me, it was Lexington Area Directors Forum. We were able to advocate to get a physical therapist assistant program at Midway College. Although it didn't last, that was my first opportunity to advocate for physical therapist assistants. I will say that Ron Mead has allowed me to continue with that opportunity by having me as chair of his advisory board. So I love that. Getting involved in KPTA, I was first the director of the Quality Improvement Committee. Wrote a manual because people were transitioning into quality improvement. Then I was asked to be the chair of the Levon Yeager Pediatric Committee, which is how we
met. Yes.
And I did that. By that time, I had transitioned to UK. So that made more sense because I was teaching in pediatrics. And then I became chair of the ethics committee for APTA. I'm going to back up because in Kentucky, after being director of rehab at Humana Hospital, I went back to graduate school yet again. There are a lot of transitions to graduate school. And I ultimately became the chief operating officer of the hospital. Shift again. Funny story there that I like to tell. So I was on a committee of all of the chief operating officers of the facilities in Lexington area. And I happened to be the only woman as well. But they were having a conversation at the time about all of the hospitals were having trouble recruiting physical therapists. And they didn't even know about physical therapist assistants, I might add. But we were sitting around the table, and one of the administrators, who is still an administrator in the region, so shall remain nameless, said, well, you know, the problem is that physical therapists are such prima donnas. And I smiled and said, I may not have mentioned I'm a physical therapist. And after there were all these uncomfortable faces, we went on to have a meaningful conversation that was advocacy for physical therapists and how they could recruit physical therapists.
Wonderful.
So last major shift it was when I chose to become a faculty member.
Mm-hmm.
And that was a crisis of conscience, to be honest.
Mm-hmm.
I was put in a position as a hospital administrator that started violating my sense of ethical behavior. Because ultimately, I care most about repairing the world and the health of patients. And so I like to say it didn't take courage to make the decision to shift because I'm a physical therapist. So I knew that is my love.
Mm-hmm.
And so then I shifted to UK and have been a faculty member, a chair, and now the associate dean. I think that answered your question.
It did. And it brought up so many things, and I'm really, really trying not to go rogue. But I think one of the pieces that you spoke to through that was just that ethical grounding that you have, that I think is your gift to this community, because it's a struggle. I mean, it's a struggle that our PT and PTA practitioners have. It's a struggle that our healthcare workers have. And I'll fully admit that I have moments of what would Janice do that float through my brain when I come into these situations. So I just love hearing you kind of talk about your path. You've also been involved with our state board.
Yes.
Can you speak a little bit because you've been on KPTA/APTA Kentucky, and you've also been engaged with the board, and how kind of that relationship developed and what your interest is in being engaged with the board as a professional organization for protection of the public versus promotion of the profession.
Right. And that was perfectly stated. The board's role is to protect the public. And if Saji's still on, she'll say, yes, I know, we hear that. And the APTA Kentucky's role is to promote and protect the profession. I do not think those things are in conflict.
No.
Because ultimately, if we promote our profession is guided towards service to the public, our patients, our communities, and society.
Mm-hmm.
There is a clear distinction, however. I think what we have found over time is the Practice Act in Kentucky, albeit fraught with grammatical errors, which those of you who know me know makes me a little crazy, is very powerful.
Mm-hmm.
And has done a great job at protecting the public. And allowing us to do more that protects the public. I happened to be chair of the state board when we were going through the process of physical therapists starting to do dry needling. And the Kentucky Medical Licensure Board disagreed and sent a request that we rescind an opinion that physical therapists could do that. That was fun. I considered that a challenge because I said, well, thank you for the suggestion, but no. And I did that with the help of APTA,
mm-hmm.
at the time KPTA. And we went through a pretty lengthy process where we worked and the board prevailed. And yes, indeed, physical therapists can do dry needling in the state of Kentucky, in the Commonwealth of Kentucky. I do think, so I was on the board and I contributed to regulation change because board members are allowed to do that.
Mm-hmm.
I happened to be involved when there was the switch to standardized testing dates.
Mm-hmm.
I was so proud when students came and advocated to the board to reinstitute temporary privileges.
Yes.
Because that made a huge difference. So in people's ability to not have to sit around after they graduated waiting for a test. So that's been fun. I loved seeing the students advocate for themselves.
Mm-hmm.
It was wonderful and achieve what they wanted to achieve. So when my term on the board was over, I subsequently was asked to teach for a national and international company that teaches ethics to health providers of all disciplines who have violated their practice acts and thus are referred for rather intense ethical remediation. It is a very powerful experience. And because the Kentucky board sometimes refers people to this called probe, that was a conflict of interest, in my opinion. And so I never have sought to be placed back on the board because I do still teach for CPEP, the Center for Personalized Education for Providers. But I was honored, and I love the fact that APTA Kentucky, first KPTA and now APTA Kentucky, has asked me to continue to serve as a liaison to the board for the association. And I think that is a wonderful role because I understand both sides of that desk and can help navigate that.
Well, and I think you do such a wonderful job with that, both because of that ethical grounding and because of that institutional knowledge, right? You're able to speak to things as staff turns over, as board members turn over, that they may not even realize or remember. So I think that's just such a valuable piece.
Well, thank you. I'm honored to do it. I do love doing it.
And I am so thrilled that you're there. I guess my last question to you would be, what advice would you offer to our young professionals, our current students, our aspiring PT students, as they start to go along this journey? What would be your guiding principle for them?
Okay, I think I have two.
That's great.
First is the biggest thing is to realize the power of physical therapists and physical therapist assistants to influence health and well-being essentially for everyone. From birth and throughout the lifespan, we know how important movement is. We know that exercise is medicine. We know that inclusion is critical, and we can help people be included. So the first thing is to recognize that power. The second thing is I would encourage everyone to fully embrace the International Classification of Functioning Disability and Health, including the critical importance of context, both environmental and personal context. In fact, if we do that, we'll consider the social determinants of health. We'll consider the nesting environments in which we function, from microsystem to macrosystem, and how important it is to influence communities, people, communities, laws. So if we fully embrace that, we will recognize the importance of equity to achieve that. So those are my two biggest pieces.
I love it. And I love that you brought up the ICF too, because of my favorite thing about it, on top of all of the contextual pieces that you just brought in, was the shift in focus from disability to strengths perspective and to health and wellness, and that it really does focus on the strength piece,
right?
And all of the contextual pieces around that, and not what's wrong. Right. And
exactly.
That's so powerful for people. So I love that you brought that up. Thank you.
You're
and
welcome.
I'm gonna resist the temptation, because I'm about to I could talk to you for hours. But I appreciate your time today, and I'm gonna pull Charlie back in to wrap us up. Thank you so much for being here. And I'm gonna pull him in to close us out.
Thank you.
Dr. Kuperstein, every time I listen to you, I learn something new. So I really appreciate that. You're a thought generator and very engaging in our profession. So thank you for your time today. Thank you for sharing what motivates you. It's very inspiring. So we really appreciate that.
Thank you.
We welcome everybody back. We'll have another giant in our episode 4, but today was a delight. So thank you all for joining us.